I am Tobi Ogbechie-Godec. I am a board certified dermatologist, who is a physician at APDerm, and I see patients in the Stoneham office in Mystic Valley Dermatology currently. I trained at both Harvard Medical School and then I also went to NYU Dermatology residency, which just afforded me with a broad spectrum of training in not only medical and surgical dermatology, but also cosmetic dermatology. Dermatology is one of the most fascinating fields in medicine because it really has everything that you can think about. It has procedural care where you're working with your hands and truly seeing a patient before and after you do a particular procedure, surgery, or cosmetics. It has medical dermatology, which is very cognitive. That means you're thinking about a patient's diagnosis and you're putting everything together. It also has a lot of research. There's a lot of groundbreaking technology that's coming out now, whether it's the medications that we're using for eczema or psoriasis, or it's even just really creative medications treating hair loss, or really groundbreaking peptides and other treatments for skin health overall to help us all age naturally. So it's just really fascinating, and that's why I'm in dermatology. So I never thought I would be doing cosmetics when I first started medical school because initially, I always thought that cosmetics was changing a person's personality and giving a person a new norm. As I've gone into dermatology, I've really realized that cosmetic is really bringing out a person's true self. My philosophy when I treat patients is to treat them to make them look natural. I want patients to walk out with confidence and everyone to just ask them, what happened? Did you go on a trip? Not necessarily to look at them saying, you look different because the entire structure of your body has changed. So I seek balance, and I think a lot of patients are seeking balance, whether in their personal life or in their facial structure. And I think that that's what we're all looking for. And one of my favorite things to do is to show a patient the before and after when we do a procedure, whether it's Botox or laser or filler, and a patient sees, how they've transformed naturally and really taken a couple of years back. I think everyone has really found that extremely gratifying, and I've definitely found it gratifying. So whenever patients come to see me for a cosmetic consultation, they're often asking, what is your favorite procedure, or what is the procedure that I should do to improve myself? And I like to just mention that it's not one procedure, it's a whole journey. It's a combination of lasers that one may use, of neurotoxins like Botox, of fillers which work in a different way, of skin health, creams, but not just any cream, different sorts of creams. So putting everything together really makes that cosmetic journey and enhances the way the person looks in the end and provides that balance. If we focus on one wrinkle, one line, one procedure, what we end up doing is maybe affecting that one particular issue, but it completely changes everything else. So we really need that harmony to understand, if I'm trying to improve the way that my forehead appears, is it only Botox, or is it Botox plus a little bit of resurfacing to even out that skin tone? Or is it something else that one might do for daily maintenance, like sunscreens, and sunscreens that could be mixed in with other antioxidants that could potentially help to prevent that damage from further happening in the future. So I think combination procedures are really the way to go, rather than just one procedure. And of course, always including skin health and creams, but not just any cream. Creams that actually have an active ingredient that are actually doing something, not stripping. That's my favorite procedures. So I also do treat a lot of skin of color, and as folks of color know, there are a lot of considerations that you have to think about. Someone who is a lighter skin but of color may react differently than someone who is a darker skin of color. And it's not just about the ethnicity, but it's about how each individual reacts to the particular procedure or product that you're putting on the skin. So I do peels, and I do, of course, a lot of other procedures for skin of color, such as lasers, Botox fillers. But in terms of chemical peels, folks often ask me, what is a peel I should use, or should I do a chemical peel? And I usually say, well, which chemical peel? We have salicylic acid, 20%, 30%. We have glycolic acid, 30%, 40%, 70%. We have trichloroacetic acid, 15%. We have Jesner's peel, and I can go on forever. So we have so many different peels, and all of them are really geared towards a particular endpoint. And you can mix and match. You can treat in the middle also with not only a peel, but also topicals. I think having that mindset of a journey overall that you're trying to get to, and being understanding of what particular active ingredients and procedures can get you to that end goal is really helpful for skin of color. But overall, you know, I think it's been really exciting to expose a lot of people of color to cosmetic treatments that they never thought they could do, because they were always told that they could not do it because they would react poorly. But understanding that journey and how to do it, not just what peel, I think has been really helpful in my skin of color practice, in addition to, of course, my other patients who I treat not of color. So I do see patients for cosmetic consultation because often people come in not necessarily knowing what procedure they want to do, but really having a specific concern on their skin. I think the first thing when you're coming for a cosmetic consultation is to ensure that your skin is in its natural state, so as little makeup as possible, just so we can see what the skin looks like and we can understand how to enhance it. I often give patients the mirror and say, you know, tell me what bothers you. And then we compare what bothers them to the entire balance of their skin. If it's one wrinkle, well, how would changing that wrinkle actually affect your entire face? So we love to go over that. The other thing too is I often get the other end of the spectrum where people come in wanting a particular procedure. So they come in saying, I want filler in my temples because I saw it on social media. Well, we have to understand what that actually will do and whether that particular procedure will fix your issue. And then I also ask people to just come in with an open mind. Now everyone goes on social media, they look at photos before and afters, and I think that that's wise to understand what the procedures might be. However, I think it also gives a sense of overconfidence in what a procedure might do. Remember that if someone is putting a before and after online, they're often putting it in an exaggerated way to showcase the best that a procedure could potentially do. A lot of times there can be tricks, I would say, and tips that they may do. So if they're trying to showcase an improvement of wrinkles, they may have a photo before where the patient is in a slightly activated phase, maybe smiling, maybe looking up, and then the after photo may have the patient more relaxed. So you always want to think twice about what you're expecting the procedure to do. However, overall, I think my patients are very satisfied after we do the procedures and they see the before and afters. But when they come in first with a realistic setting or realistic expectations of what they are trying to improve, and then we go over how the procedures that we have here can improve and enhance their look. And when they come to the end of the treatment, or really it's a journey, by the end of the first set of treatments, looking at their photos before and after, I think people are often very surprised and very pleased with the outcome. But just being very cautious about expectations and coming in with a pure face, I think that helps to have us have a healthy expectation of what we want to do in the future. Okay, so I said I don't have a favorite procedure, and I really have procedures that are my favorite, but I can speak about some of the ways that I like to treat specific parts of the body. So for example, if someone comes to me with forehead concerns, forehead lines, I do of course go to neurotoxins because I think those are very helpful to smooth out the lines and relax our muscles and prevent further worsening of those lines. I do enjoy using Fraxel or Frax Pro, a resurfacing laser that can help to even out the skin. I also love adding some topical regimens as well. For example, antioxidants like really good vitamin C in the morning and retinoids at night. Also, if I'm thinking of lower face rejuvenation, I enjoy using a little bit of filler with Botox. So you can actually put Botox in your lower face to help structure your jaw. And that's a minimally invasive treatment that can help to just shape your skin or shape your face that a lot of patients really love. For concerns about skin texture, I do love my resurfacing laser, and I love to pair it with the red laser, the V-beam or pulse dye laser, because it just helps to even out the skin tone even out some of those oil glands, the wrinkles, and some of the other blemishes that we may have in our skin. So overall, patients turn out just looking very bright. I also love treating off-face procedures as well, or off-face locations, I should say. So when a patient comes to me for treatment of the face, we often say, you know, let's look at balance. Let's look at your neck. So if we look at the neck and we realize that there's off balance, the face appears to be smooth, appears to be more of an even skin tone, but the neck or the tops of the hands have a lot of discoloration, not even skin tone. That's really what catches the eye externally when someone looks at you and says, I know that person did something to themselves because they don't look even. So we usually like to pair not just facial resurfacing or facial procedures with neck procedures, upper chest procedures, forearm procedures, and hand procedures as well. So it's a whole spectrum of treating the person, not the particular problem. So when folks are trying to book a cosmetic consultation or a cosmetic procedure with me, sometimes my schedule can be a little full. I'm so sorry, but I always prioritize my patients, so we will manage to fit you in. I often open up slots either on a Friday or another day that I have capacity. And my goal is to make sure that I'm helping my patients feel their best and meeting you where you are. So if you ever call and you can't find a spot with me, just let them know to contact me separately and we can always make things work.